Bismillahirrahmanirrahim. Assalamu alaikum wa rahmatullah. Today I'll present a very simple presentation about the 10 minutes presentation about my progress in PhD thesis. I'll start by introducing myself. My name is Mohamed Fathy. My ICD number is 201709. The type of my study is research, full-time PhD, under supervision of Dr. Omar Hayat, the Deputy Director of Entrepreneurship, and this is progress for I'm now in the second semester. The content of my presentation will cover just 5 topics. We will start by the topic or the thesis name itself. After this, we'll start about just general introduction about the thesis. The third part of my presentation will talk about the research questions. Then we'll start at the fourth part of my researches is the research objectives, and we'll end up by the research contribution. First of all, why we selected this topic? In healthcare sector, which I already work in this sector for the last 15 years, innovation is very important, and innovation actually came as a technological innovation. But if we go for the processes innovation, we found that the frontliner, the physician, nurses, and even paramedics are rare, and even they haven't the interest to share in the innovation process. Many researches has been studied even in our organization, in hospitals. Most of the time we are searching why the frontliner, why the physician and nursing and the paramedics are not sharing in the innovation process, because if they are actually sharing, this means that the process and the care will be provided to the patient actually will be much better, and at the same time the management system in the hospital will be much effective. The actual what is happening now. So this is to explain why we go for the research. For that research, actually we start our introduction about what is the importance. The importance of the innovation for the organizational effectiveness is widely accepted, and we have many researches that innovation improve the effectiveness of organizations at all the levels. In particularly employee innovation behavior, which is range from developing, adopting, and implementing new ideas for the services and work practices. This is maybe accepted in many organizations, but actually in healthcare we are lacking of the impact and even involvement of the frontliner to share in this innovation process. A variety of factors have been studied as important factors to individual innovation, such as organizational culture, commit, relation with the supervisor, and even the socio-psychological factors which impact in the frontliner itself. This is exactly what we are searching for. If we go further, we'll find that actually very few studies has been conducted to correlate the impact of the attitude and skills and behavior of the employees of the frontliner healthcare providers, and how these affect the innovation process in healthcare sectors. Actually our study will address the following questions, and we have to, by the end of our research, we hope inshallah that we will satisfy and we reach to answers for these questions. Number 1, does the healthcare worker know, accept, and practice process improvement innovation in healthcare sector? The question number 2, what factors augment and factor inhibit innovation in healthcare facility? And this can be apart from the first question, or even apart from some surveys which will be conducted to pick if the quality culture, innovative culture, or supportive supervisors will be a factor to augment or even to inhibit innovation in healthcare facility. The question number 3, after having these conclusions from the first question and second question, what is the best model to promote process improvement innovation in healthcare facility? And by reaching to the number 3, I hope that we can create or develop a model of innovation process in healthcare sector, in which many organizations, many hospitals will start adopting this model as a model of innovation in healthcare sector. Then we have the research objectives to describe the healthcare worker knowledge about process improvement innovation, to describe healthcare workers' attitude about the process improvement innovation. The third one, to describe the healthcare workers' practices about the process improvement innovation. And finally, to identify the factors inhibiting and augmenting the process improvement innovation in healthcare facility. For the research contribution, we have three levels of that research contribution, starting by theoretical contribution. Many previous studies find that the relation between the psychological and cultural factors affecting the frontliner healthcare providers, and it is relation to the enhance of the innovation behavior in healthcare sector. Our aim is to find more factors, motivational factors for frontliner practitioner. Especially we talk about the knowledge, attitude, and practices. For the practical contribution, many literatures focus on the innovation behavior from the marketing and product point of view. Very few limited literatures and studies focus on the surface innovation, especially if we talk about healthcare sector. For the empirical contribution, most of the previous studies focused on European employees. In our study, we'll focus on developing country healthcare employees, Saudi Arabia, governmental healthcare sector. Our scope in our study, the area for the study will be governmental healthcare sector in Saudi Arabia. The population of the study will be the frontline healthcare providers, covering physicians, nurses, technicians, and other healthcare providers who provide direct healthcare service for their patient. We have some operational definitions. Healthcare, what is the service innovation in healthcare, what does it mean, and healthcare providers. And finally, we have some definitions about the continuous quality improvement, because this is mainly we will focus on as a part of cultural factors in the innovation process. For theoretical model, we have this theoretical model, which is solid lines representing the relation of hypothesized to be positive. Dashed lines represent relation hypothesis to be negative relation. So here they are correlating some factor, starting by perceived organization support for organization, supervisor relation and equality, innovativeness as a job requirement, reputation as innovative, and dissatisfaction. All of these have positive and negative impact in some factors, which is social, political, perceived, expected image risk, and expected image gain. And at the same time, most of these factors have a very positive impact in the efficiency oriented perspective, which is affect the performance outcome. All of these expected image gain plus expected positive performance outcome have a very good impact about positive impact in individual innovative behavior, and expected image risk is have a negative feedback in innovative behavior at individual level. Our framework here will work in that the frontline staff innovative idea practices already have impact in the process innovation in healthcare. Our focus here to study the knowledge, attitude, and practices as a factor which supposed to be have influence the innovative behavior, and if we have some aspect which may prohibit the innovative behavior in the healthcare sector. In the same time, we are studying the culture of continuous quality improvement after committed of the leadership as a mediator factor to provide a good culture for the staff to innovate, to produce a process of innovation in healthcare sector. For the methodology approach, the approach will be qualitative followed by quantitative. The analysis unit is the individual level covering physicians, nurses, technicians, and other healthcare providers who provide direct patient care, and we are talking about all the frontliner healthcare provider. The research instrument will be adopted questionnaire. For data collection, the total population of my research, or in another hand, the healthcare providers, frontliner in this organization, governmental sector organization in Saudi Arabia, is 5,400 staff. The sample size will be 361. The sampling technique will be stratified random sampling. What I did, I have the total number of the staff and even the staff per category. So the physician are 1,130, the nursing with 3,400, the technician is 300, and others who are other technicians like social worker and respiratory therapist. The percent of this population, per the total is 20, 63, 5 and 10%. So the sample size will be the percent from the total sample size. So this means that I have to cover by my data collection is 73 physician, 230 nurse, 22 technician, and 37 from other healthcare providers rather than the physician and nurses.